So the joint, the big joints of the body, for example, the knee, the shoulder, the hip joint, these can sometimes have arthritis and pain from the arthritis, and often from soft tissue damage as well. These joints can be painful. And while surgery is helpful for most of the conditions, sometimes the painful conditions may not be improved with surgery on its own. And therefore, there are other ways to help besides what we call as the conservative measures, where you have tried the exercises, the tablets, and other strategies for managing the pain. So therefore, avoiding surgery or somebody who's had surgery, it might be helpful where you may explore other options where the pain is still there despite trying either the simple measures or avoiding the surgery altogether, or if you've tried surgery and it still hasn't worked. So therefore, these joints, which are quite important for your daily movement, for your daily activities, and you depend on them to help you get around and do your daily jobs, you need to have pain-free movement so you can do your jobs and you work and have a quality of life that you desire. The non-surgical treatments. So what we call as surgery, if you go to the basics of being under the scalpel, under the knife, to have, or under what we call as a camera surgery, you still have to have an anesthetic. You have to have the operation to repair some of the damaged tissue. And sometimes it is a joint replacement. And some of these are not applicable for various reasons. And therefore, there are conditions, for example, if you are young, or if you have medical problems that do not allow you to have an anesthetic and an operation, which could be considered a major intervention on your body, then certain non-surgical treatments like a radiofrequency treatment, where we can kill the nerve endings to the joint, for example, that allows the pain to decrease or completely resolve. So some of those procedures are needle-based, or what we call as percutaneous. In simple words, it's therapy or treatment delivered through a needle, which is inserted after numbing the skin with local anesthetic and under imaging control, either with ultrasound or X-ray. We deliver the needle to the area, which is often a joint or a soft tissue which is damaged, and either deposit the medicine, which there are a range of medicines, including cortisone, local anesthetic, and more recently, regenerative therapies as well that can be delivered to the damaged tissue. And there's a range of those therapies with different body different things derived from your own body, which can be delivered, like plasma that is taken from the blood and then treated to be able to deposit in a sterile or aseptic way. Radiofrequency treatment is more often used as a treatment to help with different pain where the nerve endings are identified, and we can treat those nerve endings either by killing the nerve endings, which are not useful other than just causing pain, and that's one of the ways. So there are different treatments, and the advantage of having a needle-based treatment or a treatment which can be used from the skin, for example, delivering small amounts of electric current to the nerve endings through a specialized treatment therapy modules, is also quite popular these days. The non-surgical treatments which are considered the most evidence-based, and we have to be fairly clear about this, that in medicine, evidence-based that we have established over the years of research is more important. And the radiofrequency treatment is considered as one of the most evidence-based treatment. It is well established. It has been around for several years, and there is a lot of research which allows, even within the the evidence-based NICE guidelines, for example, for the treatment of joint pain, for the spinal joint pain, which is called as the facet joint. So radiofrequency denervation I would recommend as one of the treatments. However, there are a different range of conditions which a skilled pain clinician or your doctor or your therapist would be able to identify for you, which may be amenable to certain treatments better than others, depending on your condition or the reason why you might be having pain. And therefore, while radiofrequency denervation has the best evidence base, there are other injectable therapies ranging from medicines, as I mentioned earlier, from steroids to small doses of regenerative therapies derived from your own plasma or blood, and other cells, other tissues from the body can also be useful. So reducing inflammation in the joint. So we have to remember that the joint pain may not always be from just the inflammation, but the pain is a complex mechanism of how your nervous system starts to react to certain damage. Some of the damage may lead to inflammation. Some of that may be just a nervous system being more sensitive and overreacting that leads to sustained pain despite the inflammation or the injury having settled down. You have to remember that if there's any moving parts, especially so where in the human body, and I'm talking about any moving parts of any device, machinery, it needs the movement to keep it working. And therefore, any pain that may be coming from inflammation or nerve problems from the joint would benefit from movement. And the movement has to be often regulated and managed so that it does not cause over or under movement or exercise, which may be over or under to try and correct the problem and therefore lead to either more damage. And therefore, you need sort of what is called as a graded exercise. There are ways to manage the inflammation besides the movement and the exercise. And it often comes from understanding of the right diet, the right way of managing your lifestyle, your weight, your sleep. And all of these things contribute to how much pressure, how much wear that your joints would be sustaining. And if the more damage and the more wear that they would be sustaining either through increased weight or pressure put through the joints or through the spine or through wrong sort of movements, they can cause more damage. And therefore, it's important to try and manage by consulting a good therapist, making sure that you have somebody who knows, who specializes in this, besides working with the pain consultant to help you manage your pain better and decreasing the inflammation. And I must emphasize that sleep and diet is very important. So there are ways to balance your diet, and I wouldn't cover details of the diet in this, but this would be something that you would need to understand and manage better. So exercise or rest for painful joints. This is often debate which a lot of patients are not sure about. And I think this is very important to get it right, because rest is what you need when you have a new injury. Rest is something that helps the initial recovery process. So if you are in a lot of pain from having sustained a sprain around your knee, or you've just had an injury to your shoulder working with some heavy weights in your area of work or in the gym, or if you are elderly and you've had sort of some damage to your joints, the most important thing when you have a new injury, a new pain, the inflammatory process needs rest for it to recover, but the rest should be in the initial 2 weeks or up to 6 weeks, just to try and let the injury settle down. But depends on the injury. If the damage is quite advanced, then it might need imaging to identify the damage and repair it. Once the initial rest has allowed the injury to and the inflammation to settle down, and there has been some imaging, for example, with ultrasound or MR scan or X-ray to identify what the damage may have been and whether it is advanced damage to need repair. Once that has been identified, the next step is exercise, and it's most important. So in simple words, past 6 weeks of any new injury, you need to exercise to try and get the mobility back. And it may be sort of rehabilitation-based exercise to return to normal level of function, or sometimes to somewhat reduced level of function. But exercise is considered most important for the long-term rehabilitation and recovery, whereas rest is more important with a new injury for the initial first few weeks. So non-surgical treatment can be quite effective in ways that most people would actually understand that surgery is the ultimate sort of way of treating the body tissues. But if you imagine the spine and some of the joints, the large joints, they're quite complex. There are lots of soft tissue, ligaments, and cartilage. And some of these are not amenable to improvement with surgery on its own. And for example, the wear and tear changes in the spine, the degenerative changes, which can happen at younger age, but often more advanced as the age gets on. The spinal changes cannot be changed with surgery. And you cannot treat all the joints. You cannot have new joints, new spine, new bits of spine put inside you, at least not at this point in time. And the surgery is not that advanced. And sometimes the surgery can have adverse effect with the pain can feel worse. For example, if there were more advanced surgery like metalwork inserted to try and correct things, that may lead to problems around and above the level of metalwork, or even at the same level. Sometimes the pain may not improve. And therefore surgery, while helpful for some conditions, for example, advanced arthritis of the knees and hips, it needs a new hip or a new knee. For certain conditions, surgery may not actually improve things because there is no surgery to change the wear and tear and the malfunctioning of the joint. And therefore, you need ways to improve the pain so that you can do the rehabilitation and exercise that allows you to then function and be able to maintain that, which means non-surgical treatments can sometimes be more helpful than surgery where it is the right indication. And that is where seeing somebody who works in this area, who understands the non-surgical treatments and can identify which is better for you, is more important than thinking that surgery is the only solution.